Good morning. Let's discuss on vitamin B1 or thiamine. It is also known as vital nutrients that help the body convert food into the energy, and it plays a key role in cell growth, development, and functions, and helps maintain a healthy nervous system. It is also known as anti-beriberi factor or anti-neuritic factor. The sources are the best source is aileron layer of the cereals. Therefore, the whole wheat flour and unpolished hand-pound rice have the better nutritive value than completely polished refined foods. So the best source is this the unpolished rice. You can see it in the picture. This is the polish. So on being polished, the upper aileron layer is get lost, and so a lot of thiamine which is present in this layer is also lost with that. So it is of very low nutritive value. And this is the basic chemical structure of the thiamine. It does consist of two components. One is the pyrimidine ring, another one is the thiazole ring. Both the rings are connected via the methylene bridge. So active form of thiamine is thiamine pyrophosphate, and it is an active form of the vitamin thiamine. How it is being synthesized? Thiamine is being synthesized. Thiamine synthesizes thiamine pyrophosphate in the presence of TPP transferase enzyme, which converts ATP into AMP, and the pyrophosphate grouping is being added onto the thiamine. So this is how there is a generation of active form of thiamine in the form of TPP. Sources, it is present in all the natural foods, but particularly good dietary sources are unrefined cereals, meat, nuts, green vegetables, eggs, etc. White bread and polished rice are very good, poor source of this vitamin. And as far as biochemical functions are concerned, so there are two important biochemical functions are being taken up by this vitamin. That is first and most important is generation of energy. Most of the energy generating reactions, metabolic reactions of the body dependent on the TPP, because concerned enzymes are dependent on this coenzyme in the form of TPP. Second is it is important for transmission of proper nerve impulse. It is important for breaking off carbon-carbon bond. It is also important for decarboxylation of alpha keto acid. Trans ketolase reaction, which is important reaction of the HMP shunt, is dependent on the TPP for its action. Three important dehydrogenase enzyme systems are dependent on the TPP. They use TPP as a coenzyme. One is the PDH complex, one of the important enzyme system concerned with the carbohydrate metabolism. It converts the pyruvate into acetyl coenzyme A, and second enzyme system is the alpha keto glutarate dehydrogenase. And third is the branch chain alpha keto acid dehydrogenase enzyme system. All these three enzyme complex, they require the molecular presence of TPP for their complete action. You can see it here, pyruvate is going to be converted into the acetyl coenzyme A. So here there is a role of thiamine pyrophosphate, and along with pyrophosphate there are other coenzyme also like FAD, NAD, lipoic acid, and coenzyme A. So all these are the important coenzymes required for the complete conversion of pyruvate to acetyl coenzyme A. Similarly, in the citric acid cycle, also the alpha keto dehydrogenase is it's also a three enzyme, five coenzyme cofactor system, and without the presence of TPP, the alpha ketoglutarate is not able to be converted to succinyl coenzyme A. And thirdly, we'll see in the next slide that branch chain keto acid, the dehydrogenase are also dependent on this TPP. So in lack of or in absence of this TPP, the two important energy generating reaction, conversion of PDH to or pyruvate to acetyl coenzyme A is hampered. And moreover, this citric acid cycle is also hampered if the TPP is not in appropriate quantities. And so branch chain alpha keto acids, they are also dependent on TPP because this branch chain keto acids dehydrogenase complex also require TPP along with the other coenzymes and enzyme system for its working. So this step is hampered. So fatty acid metabolism will also be hampered. So in also in this HMP shunt, we can see the important role of TPP in activation of trans-ketolase enzyme. So if this enzyme is not there, HMP shunt will be hampered. So we can see that there is an important role of TPP, especially in the carbohydrate metabolism. So whenever we have higher intake of carbohydrate, so requirement of thiamine is accordingly increased. Then RDA we require for adults 1 to 1.5 milligrams per day, children 0.7 to 1.2 milligrams per day. During pregnancy and lactation, it can increase up to 2 milligrams per day. Then deficiency occurs due to the inadequate intake of thiamine in diet. Raw fish and seafoods contain the thiaminase enzyme, which also destroys the thiamine. Besides, the impaired absorption is another reason for uh, which leads to deficiency of TPP. Then increased requirement is seen in hypothyroidism, fever, pregnancy, and lactation. In all such condition, the BMR is raised, and we need to have the higher intake of energy or higher generation of energy. And for energy generation, TPP is very, very important. Then chronic alcoholism is a common cause for TPP deficiency. It interferes with the absorption of TPP and conversion of thiamine to pyrophosphate. So both way, alcoholism decreases the concentration of TPP. Then what can be the biochemical changes happen due to the B1 deficiency or thiamine deficiency? The carbohydrate metabolism is grossly impacted, decreased amount of ATP production, impaired cellular functions. So you have seen in the various metabolic reactions of carbohydrate metabolism, whether it is HMP shunt or the dehydrogenase enzymes of conversion of pyruvate to acetyl coenzyme A, or of the dehydrogenase of citric acid cycle. And so these are worstly affected if the proper concentration of thiamine is not there. So that's how there is a lack of energy, decreased production of ATP, and impaired cellular functions, accumulation of pyruvate in the tissues, and excretion in the urine. Normally, the pyruvate does not cross the blood-brain barrier, but alterations due to the blood-brain barrier and allows the entry of pyruvic acid into the brain as well, which disturbs the metabolism and causes the polyneuritis. So these are the various features associated with the deficiencies of TPP. So what we have seen, the brain and the heart, the two important tissues, they are no in the due to the lack of energy, they are manifesting the deficiency symptoms. So this kind of deficiency is commonly seen in the population consuming the polished rice as an staple diet. So, B1 deficiency leads to impaired nerve impulse transmission due to the lack of TPP. Trans-ketolase activity in erythrocyte is decreased, and measurement of RBC trans-ketolase activity is a reliable diagnostic test to assess the B1 deficiency. So, this measurement of trans-ketolase activity is an important diagnostic tool in order to assess if there is a thiamine deficiency or not. Then beriberi, there are various type of beriberi which are being caused by the deficiency of thiamine. So the beriberi symptoms are anorexia, dyspepsia, heaviness, weakness. Subjects feel weak and get easily exhausted. Wet beriberi affects basically heart and circulatory system. In extreme cases, it can cause the heart failure. There is an edema of leg, face, trunk. Serous cavities and serous cavities are the main features. Dry beriberi damages the nerve and can lead to decreased muscle strength and eventually muscle paralysis. And infantile, it occurs in infants born to the mother suffering from thiamine deficiency. So you can see here in this picture what are the various symptoms associated with wet beriberi. There is a shortness of breath due to the during physical activity, because circulatory system and heart are very badly affected. Systolic BP is high, diastolic BP is low. There is a tachycardia, fast and bouncing pulse. Then cardiomegaly, there is a dilatation of right heart, and this may lead to the heart failure as well. Swollen legs, bipedal edema is there. Then ophthalmoplegia, due to there is a global confusion, coma, and finally, if it's not being checked, it may lead to death. So this is a kind of syndrome, that is what we call as an Wernicke-Korsakoff syndrome. This is associated with this constellation of symptoms. There is a confusion, global confusion, mental weakness, ophthalmoplegia is there, involuntary movement of the eyeball. Then it may lead to ataxia as well. Finally, coma and death. Dry very associated with neurological manifestations. Peripheral neuritis with numbness, tingling sensation in the lower limb. Loss of tendon reflexes. Ataxia is there. Emaciation, painful tender muscles. Then wrist drop, foot drop is there, aphonia, loss of voice, mental confusion is there. So these are the common symptoms you can see in this picture. Dry beriberi associated with confusion, emaciation, inability to speak, and then there is a wrist drop, great weakness of the extremities, then numbness of the feet, foot drop is also there, because severe peripheral neuropathy is there. Then painful tender muscles, loss of tendon reflexes, burning or tingling. These are the uh, various symptoms associated with dry beriberi. Then cerebral beriberi, that is also known as, that leads to or manifested in the form of Wernicke-Korsakoff syndrome. This is an important syndrome due to the severe deficiency of TPP. It leads to the ophthalmoplegia, global confusion, ataxia, then mental weakness is there, muscle weakness is there, and this may finally, if unchecked, it may lead to coma and finally death. So this is mostly seen in the chronic alcoholics, and alcohol, as I've already told you, that it interferes with the absorption and conversion of thiamine to active form, that is the TPP. So alcoholics usually suffer from this deficiency, and insufficient intake or impaired absorption of thiamine, loss of memory, apathy, rhythmical to and fro motion of eyeball, that is ophthalmoplegia is there. Infantile beriberi affects the children. Seen in the infants born to mothers suffering from thiamine deficiency. Breast milk contains the low level of thiamine, that can be the reason. Usually occurs in 2 to 4 months. It causes sleeplessness, restlessness, vomiting, convulsions. Death may occur due to cardiac failure. Then we can see it here. The child is not breathless. Then voice, he is crying. Initially high pitched, followed by aphonia. Then emesis, refusal to feed. Then hepatomegaly is also being observed. Respiratory distress, cardiomegaly, right-sided dilatation of the heart. That may be the reason for heart failure. Pulmonary hypertension is there. Well-nourished breastfeed infant, it causes lactic acidosis and hypotension or shock. So biochemical findings, here you can see it here, lactic acidosis, because pyruvate is accumulating. It's not able to be converted to acetyl coenzyme, so it is diverted to the synthesis of lactate. So that's how lactic acidosis is there. Then accumulation of pentose sugar into the erythrocyte because HMP shunt is arrested due to the deficiency or lack of activity of transketolase. Then decrease transketolase activity in erythrocyte is a very marked feature which can be measured, and it is a common test to diagnose the B1 deficiency.